Well, hello, everybody. My name is Garrett Schmidt. I am the managing editor and CEO of VBC Exhibit Hall, and I'd like to welcome you to today's live webinar that is hosted by WellSky, who is a client of ours, and we're super excited for this presentation today. It is called Leveraging Data to Drive Operational Quality and Patient Outcomes. And we've got a big audience today, and this is a topic that I know a lot of you care a lot about and are very interested to learn more of. And so a couple items of housekeeping before we get started, because we have a lot of material to cover today. Everyone has joined today in listen only mode. So this is a traditional webinar format. So we can't hear you or see you, but we do want to hear from you. We're going to have a time for some Q&A towards the end. If you have a question that you would like to submit at any time during the presentation, you can use your attendee module that has a spot for questions specifically, and go ahead and drop your question in there. We're going to get to as many as we can. Again, we have a lot of material to cover, so if for some reason we aren't able to get to yours, if we run out of time, don't worry, someone will reach out via email and make sure that we answer your question afterwards. Which leads me to the next thing. This session is being recorded. And so what's going to happen is when we're done, maybe about an hour or so afterwards, you're going to receive an email, and there will be a link to the recording as well as to where you can download the slides. And because, again, the slides are very full and there's a lot there, and so I'm sure you'll want to look over those and review them again. And then you can share that presentation with colleagues and friends and review it at your own leisure if you would like. Well, without further ado, I wanted to introduce our speaker today. We have with us Mr. Brad Barber, and he is the Senior Director of Care Continuum at Tampa General Hospital. So, Brad, I'm going to turn it over to you. Welcome.
Thank you, Garrett. I appreciate you and the Value-Based Care Exhibit Hall team and the WellSky team. It's been very wonderful working with both of you, and appreciate the opportunity to talk to a couple members of the crowd today, and of course across the webinar as it's distributed. So first and foremost, today's session, we're going to review a couple items around how to create success and drive operations in post-acute care. And you can see on the screen, we have a couple agenda items. I won't read out to the entire group, and a few learning objectives. Now, keep in mind, this is focused towards post-acute care, but these concepts also help drive improvement efforts in care coordination and across your system of care, and can be very beneficial to your organization. So we appreciate the opportunity to speak to everyone today. I think next we are going to move into a question for the teams to understand a little bit more about what type of organization you work for. So next you'll find that Garrett is going to release a polling question. If you would go ahead and answer this question so that we can see the various types of organizations or facilities that you work for. And we'll give everyone a minute to respond.
Okay, you should all see this question up on your screen now. And this is a choose one that best applies. I know this day and age you could be all of these things, but we we ask that you choose one that most describes at least your position where you're working for. And of course, this is anonymous. What we just wanted to show you, and we're going to show you the results here soon to see kind of where you stack among your colleagues and see who's in our audience today. So we're going to give it about 10 more seconds for the results to come in, and then we will show the results. And I'm going to close it down in 5, 4, 3. Oh, there's always one that comes in right at the end there. 2, 1. Here we go. All right. Brad, are you able to see the results on your screen?
I am. Wonderful. So it looks like we have a great mix of partners on the call today from our hospital systems, payers, ACO organizations, from post-acute, and a couple others out there. Like Garrett mentioned, it's hard to capture everyone in a question, but we really appreciate your answers and appreciate your participation today in the webinar. Thank you. A little bit about myself, just so you know who is speaking today. My name is Brad. I am a nurse by trade. I actually grew up in critical care, but before that, I graduated with my bachelor's in business management and a concentration in supply chain logistics, where I was able to study Lean and Six Sigma concepts, and of course, took that knowledge as I entered into the healthcare space. For the last 10 years, I've been working at TGH, Tampa General Hospital in Tampa, Florida. And during my tenure here, I've held multiple roles across the organization, including administrator over the ICUs, nurse manager for the medical surgical ICU, and many COVID ICUs during the COVID-19 crisis. And now I have the pleasure of serving as the Senior Director of Care Continuum for the organization. In my current role, I really do focus on interconnecting our patients across the continuum of care and building innovative programs to support care coordination for the organization. It has been a wonderful journey with TGH that I hope to continue even further, and appreciate the opportunity to speak to you a little bit about our work today. Next slide for me, Leah. To start off, just a little bit about Tampa General Hospital. We are a 7-hospital system now, but our main hospital location in Tampa, Florida is a little over 1,000-bed not-for-profit facility. We are the region's only level 1 trauma center and regional burn center as well. We are a top transplant center in the country, and recently we were just announced as the #1 transplant center by volume in the nation. We are additionally a safety net hospital for our areas surrounding the hospital. That includes 13 counties, a population in excess of 3.5 million people. And we are additionally a magnet recognized hospital for the last 19 years, and recently received our 5th magnet designation, putting us in the top 2% of magnet hospitals. Next slide for me, Leah. So to start off with, I want to talk to you a little bit about our post-acute journey. Next slide for me. And I utilize this picture quite often because a picture tells 1,000 words. And it really does, because when we're talking about post-acute care or our own healthcare journey, the path forward can be a little murky, it can be cloudy, and you may not understand where we need to go in the next 10 years. But what we can tell right now is that we can see the path forward. It wasn't formerly very transparent, but what you'll find today through our discussion is that when you leverage data in its fullest capacity in real-time data, that path becomes clearer, and you can start to see the road that you need to travel for operational improvements, quality improvements, and performance excellence for your teams. Because to be honest, the path forward is real-time data and creating the connections you need to drive your operations. Next slide for me, please. So as I started off in my role, I really had to rethink the continuum of care for the hospital system. Patients' journeys, much like the roads we travel, are not always linear. You have turns, you have to go up and down and all over the place. But what we need to understand is that we have to meet patients and families where they are at. And our goal is to keep them safe, happy, and healthy in their home environments. And what we need to do is wrap our resources around the patients to create what processes we need to have seamless transitions of care, and to remove fragmentation from those patients' journeys as they access different portions of our continuum of care. And it's vastly important that each of these sectors in acute care, post-acute care, and ambulatory care are interconnected meaningfully to create that seamless journey for our patients. And what I'll do today is talk a little bit about our post-acute care journey, so the bottom right-hand corner there, and how we interconnect with our acute care teams and our ambulatory teams to really drive operational success around the programs that we support. These efforts were not small, they are large and continue, of course, and these are reiterative efforts to really continue to connect in with these various locations and understand the opportunity and need to continue providing further support for our patients and families. Next slide for me, Leah. So when I was going into creating some post-acute care goals, I really found there were 5 core foundational items that the hospital system needed to address to drive post-acute care improvement. and excellence as well. And to start off with, that first goal is really understanding how do we optimize our post-acute network management. And in historic state, we weren't the best partner that we could have been. And we really were not looking at our post acute facilities and providers as clients and resources as we engage and extend care beyond the four walls of our hospital system. And I would like to just say that you cannot rest on your laurels. Care does extend much further than your hospital's four walls. And it's our opportunity to connect and engage with those providers, those facilities, and those patients to continue keeping them in our continuum of care and to provide continued success. So when we looked at that, we understood that we really needed to have actionable data to drive optimized network management. And that was one of our first and primary goals. And to really understand that the dynamic of our relationship with our post-acute providers had to change. No longer were we just a facilitator of patients into their facilities or into their locations, but we are a partner in the delivery of care. I want to underscore that we are now a partner in the delivery of care. Secondly, we really looked at formalizing the care team roles and responsibilities within the organization and outside of the organization. So, how do we interconnect these teams and create accountability for one another so that we can drive the goals and the outputs we desire from our programs? And so, really taking time to dig in not only with our internal teams, but with our post acute teams to understand how we can work better and align better with one another. And I'll talk a little bit further about that as we go through our slides today. The third goal, and naturally, maybe one of the highest goals we have is really to enhance the patient and family's engagement and experience. So we're really focused on the patient experience while they reside in our hospital system, but what happens as they exit the hospital system? We want to make sure that those patients and families are having an optimal experience as they transition through various levels of care and hopefully re-enter our healthcare systems after they are done with their post-acute care support. Our fourth goal was really proactive post-acute care planning. And that actually sits inside the hospital walls, but really looking into how are we engaging in care progression and making sure that we're setting up the correct conversations with our patients and our families to prepare them for the post-acute care they need to support their recovery. And really being thoughtful about the education we're providing so that our patients and families have higher utilization of post-acute services for better outcomes. And lastly, we were really looking to maximize the technology that we had available to help support our overarching post-acute goals. And in historic state, like many facilities know, we were working with outdated CMS data. And CMS provides wonderful data, of course. It's really great to track and trend, but it wasn't useful to have real-time conversations with our post-acute partners. And it wasn't a value-add conversation to sit down and say, sniff A. I noticed 18 months ago on the CMS data that you had high ED readmissions. That may not be the same administrator covering that building or the same team that's supporting those patients. So really, we're looking to shift the dynamic and leverage technology to the fullest extent to have real-time data-driven conversations with our partners, which has been a wonderful project. Next slide for me. Many of you are familiar with this framework. So this is the Baldrige framework for performance excellence. And as I mentioned, I have a background in Lean and Six Sigma methodology, and that is really focused on process improvement. But we're really looking to create performance excellence across post-acute care to drive best practices across our organization and into the community. So as we started off this work, we really dove in with the leaders of our post-acute care facilities and teams to align and provide support for those individuals that was inclusive of strategic planning. So very direct conversations with our partners to understand, what are your goals? Do you know what our goals are too? Let's see what we can do to create shared goals together so that we're all working towards the same thing at the same time. and driving more focus into our post-acute customers, because they are our customers and we are working with them as a partner. And they need to feel like a partner in the delivery of care as we're really trying to drive forward value-based care ideology, not only within the hospital system, but within the post-acute care space as well. I'm going to skip over the bottom because that is the utmost important. But as you move over to the number 5, our workforce focus and inclusion, this really gets down to my Six Sigma days where we were taking and doing Gemba walks with our frontline teams, not only within TGH, but within the community as well. And even I myself took time to shadow our RNs, our PCTs, and our skilled nursing facilities to really understand what were their challenges and what were the opportunities for us to engage with those teams? Were there specific educational content or items that we could deliver to help elevate the practice of our post-acute partners? And what we found is absolutely. And these individuals are hungry to have the same knowledge and learning that even our own team members have. And that is vastly important to share the knowledge we have as well. We really wanted to work with our post-acute leaders to drive operational alignment and focus. Again, when we were doing inclusive strategic planning, it helped drive the operations not only from the organization standpoint, but from the post-acute standpoint as well, and giving them better transparency on the performance of their own patients that they never had before. And again, we all worked towards shared goals, metrics, and drove towards the same results. This is our goal for the year, and we are all aligned and on the same page. And to do that, you really need to work on continuous measurement, analysis, and knowledge management. This process doesn't work if you're not continually engaging with these teams and continually understanding the opportunity and need to partner further to create the value that we want to for our patients. Next slide for me. So we'll talk about why are we doing this? Why is there even an initiative to improve, Brad? Because we are trying to drive value. And value is driven from increasing the quality of care patients receive while additionally reducing the cost of care. So what we're looking to do here is drive patient outcomes for the hospital system, but additionally for our post-acute partners. And in turn, when we create further connections with our post-acute teams, we reduce the fragmentation that our patients and families feel as they transition across different post-acute levels of care and back into our environment. That naturally improves their experience. And as we work further and create additional connections, stronger partnerships, we're able to influence some of those direct and indirect costs of care for the patients to really continue to drive value, not only for the organization, but for our post-acute teams and for our patients and families. This is our overarching goal. Next slide. So I want to talk a little bit about the structure that we created for post-acute engagement and success. Additionally, this is the structure that we create for care coordination success in all transitions of care. It's vastly important that you have the right team members in the right place to support your patients. Next slide for me. We leverage many multidisciplinary teams across the hospital system. So no, this is not a full list of the team members who support this workflow, but rather my team members who support it. And from TGH Care Coordination, of course, we have our case managers, our social workers, our various partners across the system that are working towards improving patient care and coordinating patient care. But what we've found is that improved care transitions and a focus on care transitions does lead to positive patient outcomes. So within the acute care space, we have our TGH Transitional Care Center that's staffed out with APPs, RNs, medical assistants that are partnering with our inpatient case management and social work teams to transition our patients into the post-acute environment. And as they move into the post-acute environment, we have a sub-team of post-acute care continuum specialists or our post-acute care nurses that are managing those patients as they enter into the post-acute space. They are partnering with our downstream teams to ensure care progression for our patients in skilled nursing, that we're meeting our therapy goals for these patients as well. And they're honing in on the discharge processes of our post acute partners to make sure that these patients are interconnected back with their specialist physicians, with their primary care physicians, and even continued chronic care management if they qualify for these programs, and really leaning on our ambulatory nurse navigators to manage that flow of the patients back into the healthcare system. Now, not only does this benefit quality, but there's an operational need around this as well in a business case. So all of us are very concerned about seepage of our patients and retaining them within our continuum. But as your patients discharge from various post-acute levels of care, this is your opportunity to continue to engage them, to continue to bring them back into your organization, to improve your financial efforts, but also to improve your quality efforts as well. Next slide for me. As I move into post-acute, we take our various partners and formed a triad to really manage our post-acute providers and facilities. And this triad is in partnership with our case management team, our senior directors of case management, our managers, our directors in social work as well, and working in conjunction with my post-acute RN teams who are really on the front lines of the SNFs to understand what are our opportunities, what are our needs there, and myself in Continuum really roping together all of the work and driving the connections to keep our patients and families engaged. And so as we're looking at this work, we need to understand that improvements are not to the post-acute facilities alone. We all have the opportunity to improve. So we have the opportunity with those PACS RNs in the front line to understand, are we passing forward the correct clinical information to our downstream partners? Are we making sure that we convey the risk of readmission for these patients? And are we accurately conveying those patients and families' goals of care? Because we should be focused on these items and making sure that we're hitting them together, of course. Next slide for me. And really, when you want to drive further post-acute engagement with your partners, leveraging your triads or multidisciplinary supports, there are three core items that must be in place to do this. You need to have enhanced communication channels. So there does not need to be any fragmentation in the communication you have with your post-acute teams. You need to be readily available to answer to patient concerns, patient needs, or even the post-acute concerns and needs. Again, we are business partners in the delivery of care, so we have to maintain those effective and enhanced lines of communication with our post-acute providers. We really needed to make sure that the post-acute providers felt included in the work that we do. They do not work for us, they work with us as a team, and really creating that mentality where we have a shared and safe space to openly talk with one another, of course, about our needs, about the opportunities. And if our post-acute care providers are relaying they have needs for certain educational topics or to bring team members in for training, we make that happen for them because it's the right thing to do for our patients and for those families. And lastly, real-time data sharing. So it is only beneficial if you have your team members talking about what's actually occurring in current state. No longer can we talk about what was happening 2 years ago. We have to talk about what's happening with our patients right now so that we can make actionable changes to improve the quality of care, to improve the patient experience, and to help control the cost of care for our patients and families as well. And we have found that if you target these three items, you will generate greater post-acute care engagement with your partners. Next slide for me. I want to talk a little bit about establishing some real-time data-driven performance network and reports. So our performance network, many of you have your PPNs. Those are your partners that have committed to providing high quality of care to your patients. They've committed to partnering with your facilities to really improve our operational efforts and to align shared goals with our teams. Next slide for me. So what we've done is leverage the WellSky CarePort data to start driving our skilled nursing facility performance network tiers. And this is new for us, actually. We stepped down this path in 2024, and it's been wonderful to create tiered levels of performance network partners. Of course, we want all of our partners to be a tier one provider, but we recognize that there are different things that happen in post-acute: changeover of leadership, maybe utilization of contract nurses, et cetera, that can impact the quality of care patients receive. And we wanted to be able to provide the opportunity for our providers to improve their care, to remain within the PPN, or to exit out of the PPN with the option to rejoin after they've improved some of their metrics. So what we're trying to hit here for our tier one is that CarePort quality score of 3 or greater. And that's a leading indicator score of real-time data. This is very important to us, and we focus more on the CarePort quality score than we do the CMS star ranking as a lagging data metric. But we are looking for all of our tier one facilities to remain over that 3-star rating. We are really pushing for an ED revisit rate of less than 9% and a readmission rate of less than 21%. And of course, we're taking in our length of stay opportunity through the median length of stay at less than or equal to 24 days. Now, if our teams are not meeting these metrics, you can see on the right-hand side the amount of time they have to improve these data points. Of course, since we're working with real-time data, we expect these quality improvements over the course of a quarter outside of our CMS star rankings, generally giving those 6 months time. Now, we have had to work with some of the teams because CMS has not been doing their surveys as readily as we had hoped, and some of those star rankings are lagging. So we've had to do a little bit of work around that, but what we have been able to leverage is our CarePort quality score, which has not lagged, which has been highly beneficial for our teams. And we take these tiers and we apply them to the reporting dates that we receive from the CarePort teams. On the next slide, you can see. So as the CarePort reporting windows are opened, Leah, if you'll move to the next slide for me, you can see that we're looking, and we share this table with our post-acute partners. They know exactly when the hospital discharges are occurring. So for the first quarter of 2024, we're looking back through hospital discharges from October through February. So they have a 30-day run out all the way until the end of March. Of course, that data is released generally around the mid-month, the following month, and we have our quarterly PPN at that next month. So you can see that one occurred in May of 2024. We're highly engaged around these reporting windows and creating the structure for our quarterly meetings for our post-acute partners. When they understand what we're looking at, it brings forward transparency in the goals that we're trying to create, of course. And we also additionally open up our CarePort Insight and Connect platform to our post-acute providers so that they are able to see their real-time data. We want to understand how our TGH patients are doing. I love that the other patients in the community might be doing well, and that's wonderful. I'm an altruistic individual, but I'm more focused on how the TGH patients are doing. Next slide for me. We additionally send monthly scorecards to our post-acute providers. We recognize that not all of them are diving into the platform, so my post-acute RNs pull this this scorecard up for the team. We generally track the last 5 months of data we have to provide 30-day hospitalization rates, that median length of stay, and to showcase our CarePort quality score. And we want our partners to be meeting the PPN metrics. And so the only way to do that is to keep them informed of this real-time data. We additionally send this data not only to our facility providers, but we report it out to their regional VPs as well, because we found that we need to include all partners across the lines of business to drive quality improvement. Next slide for me. The CarePort platform, of course, as well, has created increased market transparency for the teams. So no longer do we have to dive back into the CMS dashboards. It's all readily available in one platform for us. And it pulls in the different performance indicators for the various facilities, and it creates a market benchmark rate for all providers in our location. And our goal is that our performance network is always beating the market. These are our providers that have committed to quality care and committed to patient improvement. And that is the metric that we are always driving to be under and better than the market rate, of course. Next slide for me. In addition, we're taking these scorecards down to individual Excel level data with line items for patient by patient, which is bringing increased transparency and allowing us to provide additional data to our post-acute partners in the skilled nursing facility space. What you see here is a data report from CarePort Insight and Connect. And what I can do is stratify this data by the attending provider in the SNF to understand which providers in each skilled nursing facility are providing higher quality care to my Tampa General patients, and helping the facilities understand, are there specific conversations we need to have with those teams about readmission reduction improvement, quality of care improvement, and really creating the opportunity for more value add conversations with these post-acute partners. And it's also additionally been an item that I can leverage as I manage different post-acute provider groups, geriatricians and SNFists, and I can happily say that my team is the 4.8% readmission rate, but it gives me another leg to stand on as I'm expanding my programs and showcasing the quality of care that we can provide and the service levels that they can expect when my provider teams are operating in their locations as well. Next slide for me. And what we've done is really leverage this WellSky data to drive our clinical workflows, EHR optimization, and our internal dashboard. So I'm going to talk a little bit about how we use some of the alerting criteria to really enhance our clinical workflows, how we take some of the attributions and drive them back into our EHRs to create transparency across our system of care for when a team is working with a value-based care patient, and then how we are taking this information and pulling it into internal dashboards. Next slide for me. What you can see here is that we're really leveraging CarePort Connect to drive BPCIA attribution. And if you're not familiar, BPCIA is a value-based care program, bundle payments for care improvement advanced. And when patients meet certain DRG criteria as a Medicare payer, they automatically fall into our bundles. We were having to track the DRGs in-house of these patients, and additionally late coded DRGs to make sure that we did not miss any patients that should be falling into our programs or attributed to our programs. What you see here on this screen is our Microsoft Teams channel. So we know our team communicates with one another via Microsoft Teams. We spend a lot of our day in that platform. And instead of driving those alerts into individual cell phones or email addresses, we chose to drive these alerts into our CarePort channel within the Transitional Care Center. In here, you can see a high priority alert coming across for a cardiac arrhythmia patient with that final DRG that was coded differently from when they exited the hospital system. My team needed to pick up on that quickly and engage with that patient and family so that we can really wrap our arms around them to help improve quality of care and outcomes. And you can see in our messages, the team member responds quickly. Noted, we scheduled that call with the patient and with the post-acute care team and their initials so that we know it's handled. Of course, if it's driving into individual phones or emails, you lose this transparency across the team, whether or not a patient is being supported. Next slide for me. Again, these are some of the ADT notifications that come out of CarePort directly into our Microsoft Teams channel. So we are pulling patient admissions, discharges, interfacility transfers, and bringing that forward for our frontline clinical team to make actionable steps in their workflow. So what you can see here is a patient that was discharged from our hospital system. We knew this because we actually see them in our own EHR, but it additionally drives into our Teams channel for not only TGH, our area hospital systems, our home health providers, our skilled nursing facility settings, so that the team understands the exact time that patient is transitioning to provide that additional support for them. So as that patient is discharging out of the hospital, you can see here, we scheduled our first call with the patient and the team noted that so that everyone knew that patient's coming up to be followed up on post-discharge. Next slide for me. We're really interested, of course, additionally in value-based attribution and creating system-level awareness of patients that are being supported by our various clinical teams. And our goal here really around attribution awareness is to coordinate better care for our value-based care patients and to create successful transitions to high-quality providers and home, and really to drive the most appropriate levels of care. So when my patients are flagged as a value-based care patient, my clinical teams know when they're taking care of them, whether that's post-discharge from the hospital or post-discharge from the SNF. We have the opportunity to engage with other care teams that might be providing care for our patients if they sit outside of the hospital as well. And then to really work with our inpatient teams to create that transparency and awareness. This is a value-based care patient. Are we choosing the most appropriate next site of care or level of care for that patient as they exit the hospital system? Of course, if you don't know they're part of a value-based care program, you're not focusing on this. Why is this important to TGH? Because we really want to be able to augment our team to support coordinated care for our attributed patients, whether that's in our own hospital or within a different location. We really want to improve the length of stay, if that's from the initial admission, a readmission, to decrease that time for the patient and families when it is medically appropriate. We also want to reduce our readmissions and remove barriers to discharge for our value-based care patients and creating the transparency for our teams to know when to do that. And you're saying, how are we going to achieve this goal, Brad? That's very lofty to create that level of awareness. We're really leaning into our own electronic health record and into Epic for this. So bringing these attribution tags directly into our native EHR for those clinicians and those providers that are caring for the patients, flagging, banners, wherever we can place that attribution, we're putting it in the chart. And not only ensuring that they can see it in the inpatient environment, but that these teams can see these flags and criteria across our outpatient environments as well. And we're developing more awareness around these patients through the full continuum. And of course, you will find, as we were talking about the journey, you can only see the path forward if you understand what's happening and if you understand whom you're caring for. So this is pivotal to our success. And we're leveraging this to create deeper partnerships to support the management of our patients with our own clinical teams and with our community teams as well. Next slide for me. What you'll see here is a little snapshot of our native Epic environment where we have brought some of these attribution tags into the clinical episodes for the patients. So as the clinician teams open these records, they are immediately faced with a banner right away that shows, note, this is a BPCIA patient. And it's to have them take a moment to stop and recognize this and to recognize, oh, what is that? And if they click into these flags, we actually put in bundle start, bundle in, their diagnosis, who the transitional care team member is supporting them, so that our downstream teams know who to connect with when they have questions. Again, to really drive that further transparency across the system around which value-based care patients we are supporting. Next slide for me. So what you can see here is interesting. So as I started off this work, I began by creating very manual dashboards. These are actually PowerPoint slides that I created for our post-acute partners and facilities. And we were tracking their readmission rates comparatively to the last performance release from CMS, and additionally tracking their ED revisit rates, leveraging outdated CMS information. That is on the left-hand side of the screen. On the right-hand side of the screen, you will see how we embedded some macros into the PowerPoint slides to create longitudinal tracking of the team, and then facility scorecards for our different case managers and teams that support post-acute care, so that they would immediately know what are the quality ratings for these facilities, their ED readmission rates, hospital readmission rates, improve mobility. We're pulling in the minutes per each discipline within these locations and the clinical programs that they support, so that we can have conversations with our patients and families around what facility may be able to best support the diagnosis of that patient. And then, of course, tracking our referrals and acceptance rates from these locations. Now, I spoke with the team before we started today, and I was really upset because I have a meeting with our business intelligence group later today for final validation of our new dashboard. So over the summer, our hospital system partnered with a very large analytics shop, and we're going through a process now to recreate our dashboard in a third-party environment. I'm going to just talk about this since I don't have a picture to show you, because it's really, really wonderful work. We are leveraging the CarePort patient encounters. Those come through about 4 times a day, and pulling those flat files into our data lake and into our dashboard environment, and collating that data with our own internal EHR data. And that sounds very complex, of course, but what we're trying to do overall is to create that patient journey. So I can see when they enter the hospital system, when they exit, when did my team make that first call? Did home health care start care? Were they readmitted following that time? So that we have better actionable data, even internally, for our own teams to improve. Did we miss that first call and that patient readmitted? But we won't know that unless you actually can see the entire patient journey in one location. And you really have to work towards that, because no one system is going to provide you everything you need. There is not a one-stop shop for everything, but you can leverage the data that you receive out of these platforms to really create meaningful workflows for your teams. And so what we can do within these dashboards is stratify our populations based off of their diagnoses. We can look into the success rate for our RNs and first calls, subsequent calls. We can see whether or not, as we're navigating patients into our own provider clinics, our specialty clinics, if they've followed up on those visits and if they've actually been completed, or missed visits where our team needs to step in and reschedule appointments for patients. And it additionally provides the opportunity for non-ER EHR based communications for the team to track and trend notes for the patients that can be visualized anywhere at any time. So hopefully I'll be able to come back to the team and share that, because it's really wonderful work, and it wouldn't be available to us in this level of detail without our partnership with the CarePort team and leveraging the amount of connections and data they have. And so to speak to that extremely quickly, thousands of hospital systems connected in their discharge platform, 17 state HIEs, really giving us increased transparency, not only of our region, but of our state and of the nation as a whole. This has been really wonderful to see progress and to see the amount of data that we can get as we partner with our CarePort team. Next slide for me. So what you're probably wondering a little bit is, you've talked a lot today about What are you doing with this data? How are you structuring your team? Is this actually producing the results that you wanted, Brad? So did CarePort Connect actually derive the ROI that we wanted for the hospital system? And I'm happy to say that it has. It has really improved our efforts as we've worked with our post-acute partners. And the data that I'll show you today is specific to skilled nursing facilities. I apologize, some of it is old, so I'll give you some updated rates as well to just highlight that we've been able to sustain some of these measures. So what you're looking at here is some data across 2023 as we entered into 2024. What we can see is that we actually decreased the amount of SNF patients that we were sending out of the organization, but across 2024, that number did increase. Our case mix, our average case mix index has been increasing year over year. And this is an important figure to make sure you keep in the forefront of your mind. So as we know, many hospital systems are working to reduce their length of stay to drive better operational improvements and financial gains for the facilities. What that does is shift the acuity of the patients into our downstream partners. We have to recognize this, that we are all shifting acuity into our downstream partners, and to make sure that as that case mix index continues to rise, that we're continuing to maintain and stabilize those quality metrics as well. So in July of 2023, we hit our all-time high for SNF readmissions. We were sitting at 18%. This is actually the month that we launched the CarePort platform to our post-acute partners. And the month that my post-acute care continuum specialist, excuse me, that's a mouthful, started with the team. You can see after they started a steep decline in the readmission rates from 18% all the way down to 7.4% for these patients in April of 2024. And happy to relay that while that average was sitting over 12%, we are now moving that average closer to our 10% range and aligning with the top 20th percentile of academic medical facilities in the nation, because it is our goal to become the safest and most innovative academic medical system in America. And I want to applaud not only my team for generating these results, but my post-acute care teams for the partnership that they provided our groups to really secure this level and to stabilize this level of quality for the patients exiting the hospital systems. And of course, as we continue to leverage our real-time data, we hope to further improve these rates, to continue decreasing our ED readmission rates, and to continue decreasing our hospital facility readmission rates as well. Next slide for me. So you may ask, where are we going after this? Of course, we started this work with our skilled nursing facility settings, and we're now moving it into our home healthcare settings. But next slide for me. So we're continuing to build additional skilled nursing facility connections. One important thing to note is that we are dealing with patient data, and to make these connections with our various post-acute providers, we do have to go through BAA agreements and a little bit of a process to engage them. It's a very easy lift when you're working with the CarePort team, but of course you need to continue engaging with the partners that your hospital system is discharging to. In our given area, we sometimes have a lack of skilled nursing facility beds, so we can't always discharge our patients to those high quality providers. But what we need to know is the performance of our patients in those alternate locations as well, so that we can engage with them further. You may not sit in our performance network group, but that doesn't mean that we can't connect with you, we can't engage with you, and we can't work towards quality improvement together. Secondly, we'll be working to onboard additional home health care providers. We've already started with our preferred partner network, and much like we honed in on skilled nursing facility care, we will really begin to heavily engage those home healthcare companies to drive quality improvements with them as well. And additionally, to begin establishing some connections with our inpatient rehab facilities in the area, whether that's through our HIE or through CarePort, and with our long-term acute care partners as well. We're really working on our EHR attribution tags and our partner support. So we're continuing to surface these attribution tags into our Epic environment. We are leveraging attribution tags to understand who we need to partner with for furthered care coordination of our patients, of course. And we're continuing to improve our system awareness of value-based care patients, but additionally of the other patient populations that we support. So while we may not have a bundled patient, we may have a readmission reduction patient that we're working on for the hospital. They need to be flagged and tagged so that our downstream providers understand whom they're working with. And we don't stop there, because when we're sharing data, it's important to remember not all data is equivalent, of course, and we need to be sharing the same types of data with one another, the same CCDAs for my IT folks there. The architecture of our CCDs needs to be similar so that we're receiving the same clinical information. We have been partnering with the Florida Hospital Association and the Florida Healthcare Association as the Senate President for Florida called upon us to create the nation's gold standard for skilled nursing facility care. And we're leaning into our Florida Hospital Association partners to really standardize the type of data that's shared between hospital systems, but also with our post-acute care providers as well, and working through a process to automate 3008 information into a clinically transferable document to those providers. It's been really wonderful to work on these efforts, and it's been very wonderful to partner with our CarePort team. I know Leah's going to advance to some of our next slides, and most likely the end slide, of course. Oh, excuse me. We have one question before we open it up to questions from you and the audience. Where is your organization in adopting technology to track and collaborate, to track patients and collaborate across the continuum? Garrett is going to open this question up for you. So if you take just a moment to answer this, we'll provide the teams about 1 minute.
All right. Yeah, you should see this question up on your screen. And just to reiterate, these are anonymous, so don't worry about that. We're just trying to gauge kind of where the audience is here, and we're going to show the results so you can sort of see among your where you stack among your colleagues here. And again, where is your organization in adopting technology to track patients and collaborate across the continuum? Not considering it yet, interested but not ready. We're exploring the idea. We're actively researching and need more information. And we already are using a solution. And any of those are great. So I think most of the results have come in. So I'm going to close it down in about 5, 4, 3, 2, and 1. And we're going to show the results here. All right. Brad, are you able to see that on your screen?
Yes, I am. Wonderful. So it looks like we have quite a number of people who haven't considered or interested in exploring the idea. So that's really wonderful that you're really leaning into, the opportunity to leverage data to drive additional operational and quality improvement efforts. I do see we have some that are actively researching and need more information. This is absolutely your time to connect with the CarePort team to understand the type of data that you can get that can help you improve your efforts, and applaud those who are already utilizing a solution to really drive your efforts and operational improvements.
Oh, okay, it looks like we have some time for some audience Q&A. Just a couple minutes here. Now we have a big audience and we have a lot of questions, so we probably won't get to very many of them today, unfortunately. But don't worry, someone will reach out to answer your questions. So if you have one, go ahead and drop it in your attendee module, and we'll get to as many as we can. First question here is, let's see. Do all your SNFs, home care, and acute rehabs use CarePort? Some of our facilities are not able or are looking at options.
So the benefit of having CarePort Connect and Insight is that your downstream providers don't actually have to leverage their platform for their referral intake solution. You are creating these connections directly with their electronic medical record. So while they may utilize the different platform to absorb your referrals from the organization, you still have access to that data for the patients.
Wonderful.
And I'll
Next
stop. I'll
question.
give a plug
Oh,
for the
yeah, go ahead.
CarePort team as they are working to really create a solution, their intake solution, that will allow their teams to absorb referrals from the Navi Health product and the CarePort Transitions product in one location to really drive effectiveness of those post-acute facilities.
Awesome. Yeah. Yeah, kudos to the CarePort team for sure. They are great. Next question here is, does your model only track patients in a skilled stay, or do you track all patients at the nursing facility?
So that is a wonderful question. I apologize for skimming over that. So we do not only talk about value-based care patients. We track all patients from Tampa General that go into our post-acute care spaces. And we recognize that the volume of value-based care patients in any given location can be relatively small comparatively to the overall organization. So as we're interacting with these partners, of course, the focus is on value-based care, but we're additionally talking about the quality of care and the care progression for all patients that are coming out of the organization. And the data that I showed you was not respective to value-based care, but actually for the overall organization and our skilled facility improvements.
Wonderful. Moving right along. The next question is, where does CarePort get their data from?
That's a great question. So CarePort gets its data from their own internal network. So anyone that is discharging on the Navi Health product or the CarePort Transition product, and maybe one of the CarePort team may have to correct me, but that's 1,000 plus hospital systems across the US. They also interact with 17 different state HIEs. And in addition, we have our direct connection with the electronic health records of those post-acute partners that you engage and bring into your network. This allows us to really create a greater transparency across our region, state, and nation.
Wonderful. Next question. How do you determine thresholds or benchmarks for ED visit rates and readmission rates? And is this state national data?
Yes, so when we started off this project, we were really looking at national data and statewide data. So to uphold the Senate President's ask to create the gold standard in the nation, we are utilizing national benchmarks for ED revisits and readmission rates unless Florida is already beating those national averages. So in those cases, we will lean on the Florida rate because we want to continue our improvement efforts. But in general, they are benchmarked off of our CMS data that we can receive.
Okay. I think, unfortunately, we are out of time for today's session. And again, we have the questions that are pouring in here still. Please answer or ask your question rather, if you have one that is burning, and someone will reach out to you via email to make sure we get your question answered. But as we conclude, first of all, Brad, I want to thank you for a fantastic presentation and very thorough. I know there was a lot here, and you guys are all going to receive an email that's going to have a link to the recording to where you can review that, and then also to where you can share it with colleagues and the slides as well. But as we close out, I wanted to encourage you all to head over to vbcexhibithall.com where you can learn a little bit more about WellSky and the CarePort product. And they have a virtual exhibit booth that has their information on it. So you can kind of really drill down and see what they're doing in the space. If this is a solution that may be of interest to you, there's ways to reach out, of course, to them. And then finally, if you would like to reach out directly to the WellSky team, feel free to do so. Or you can reach out to Brad directly. His information is here, his email, and his LinkedIn QR code. or and if you're trying to reach out to the WellSky team, feel free to reach out to me as well, and I'm happy to facilitate an introduction if that's easier to do. But thank you all so much for spending your afternoon with us. This was a great presentation. Hope you all join us on the next one. Thank you all so much, and have a great rest of your day. And stay warm. It's cold out there. Bye bye.
Thank you.